Covid-19, the battle we weren't prepared for. As COVID-19 cancellations and quarantines swept the globe, Canada wasn't the first and certainly will not be the last. As we scrambled to cancel flights, haggle with Airbnb hosts, and pull together a festival-run contingency plan, this moment has provided an illuminating reflection on privilege. Global pandemics and natural disasters tend to reveal a person's economic and social capital, or the lack thereof. Some facets of the population can shrug off these events as an inconvenience, while for others it spells catastrophe. As this particular global crisis ripples through our industry, the impacts on those struggling at the margins can be felt for a long time to come.
Brought in some pretty extensive physical distancing fines for those failing to physical distance. We've shut down all the recreation facilities, and we have fines that range from $500 to $100,000 because we can't have people out there holding parties, making the rest of the community at risk. I would note, though, and despite all our efforts, we've still seen cases rise. We've got over 1,400 cases in Peel Region. We had a beautiful Tamil family pass away last week that I think everyone knows about, left 3 wonderful daughters that they hit our community hard. And we had a healthcare worker die at Brampton Civic. And so this disease has been pretty hard on our community. And at City Hall, we're doing everything we can to support the community. We deferred property taxes by 5 months. Toronto did it by 2 months. Mississauga did it by 3 months. And so we're trying to show compassion because we know this just isn't a health pandemic, it's an economic firestorm. But it's tough days.
COVID-19 marks the return of a very old and familiar enemy. Throughout history, nothing has killed more human beings than the viruses, bacteria, and parasites that cause this disease. Not natural disasters like earthquakes or volcanoes, not war, not even close.
We get this correct. Being resilient doesn't mean that we don't feel sad or we don't feel angry or we don't feel upset because of a traumatic or difficult situation. It is simply means that we find a way to deal with it, right? So I know as a community that we had gone through a lot. So I have clients, family members, and other people in the community, they had spoken to me, telling me that, we have seen much worse than this. This is nothing new to us. We had gone through a lot. Absolutely, I agree with you guys. But that doesn't mean that you should underestimate the current situation, because what we had gone through during the wartime in Sri Lanka, that we knew the enemy. We knew the forcible enemy. And we were able to prepare ourselves to handle the trauma collectively as a society to an extent, or collectively as a family member, as a team, as a group, not individually. But the COVID-19, that we don't know the enemy. We don't know what we are going to face with. And everybody is isolating themselves. Everybody is distancing themselves. So that collective structure or the infrastructure even within a family, it's being dispersed during this difficult time, which is completely different and which is something strange and unusual for any community or any human being. So let's not take it easy.
As of March 26th, there were more than 470,000 confirmed cases of COVID-19 around the world and more than 20,000 deaths, touching every continent, including Antarctica. This was a pandemic. In reality, but before the World Health Organization finally declared it one on the 11th of March, and we should have seen this coming.
Because of the significant shutdown, we know that many people around Canada have been impacted directly financially, as well as in other ways, the loss of jobs, inability to pay rent, struggling to, their independent contractors to be able to access supports. So the second thing that government has done is to make sure that we have the right economic supports for individuals and businesses. So starting off with the expansion of the employment insurance benefits. So the initial 1 week waiting period was waived. Then we've introduced the CERB, Canada Emergency Response Benefit, which is accessible to people from March 15th to October 3rd. And it's a payment of $500 per week that allows basically $2,000 a month into people's pocket, and this is a result of their impact of COVID-19, whether they're staying from work because they're infected, or some family members infected, or they're self-isolating, or the company simply is not functioning, or the kids are in school. So for a variety of reasons, people who are home and who didn't voluntarily quit their job are entitled to the Canada Emergency Response Benefit. We also made sure that the Canada Child Benefit, which goes out every month, for the May payment, we're adding $300 additional per child. So if you have 3 children, it'll be $900 for the duration of the epidemic, and that's to support those with children. And then the GST rebate was deposited into people's account as of last week in April, and that again amounts to about $400 for individual and $600 per couple. This is on top of supports we're providing for businesses.
Some 50 to 100 million people died in the 1918 influenza pandemic, numbers that surpassed the death toll of World War I, which was being fought at the same time. The 1918 flu virus infected 1 in every 3 people on the planet. HIV, a pandemic that is still with us and still lacks a vaccine, has killed an estimated 32 million people and infected 75 million, with more added every day.
There are only a few, very few Tamil-speaking and the psychiatrist who works in Scarborough area. I'm one of them. I see a large number of clients from Sri Lankan Tamil community primarily. So what I have seen in my clinical experience lately, that the anxiety due to COVID-19 has drastically increased, and the requests from existing patients and the new patients, the clients approaching me or approaching my clinic or the hospital has also significantly increased during this difficult time. So this is the effect that we see during this COVID-19 situation or the pandemic, but I'm a bit more worried about the future after this pandemic has subsided, and the impact of this negative the influence from the pandemic is going to be quite that drastic. We all have heard from the media that the government has allocated a larger amount of funding for mental health, and we all wonder why. The impact, the post-COVID-19 impact is going to be very drastic. Why are we talking about post-COVID-19 impact? Because I guess we have to plan ahead. Otherwise, it's going to be even, the impact can be multidimensional and disproportionate if we don't prepare ahead of time. I would say this is a great opportunity to bridge the gap between your family members. Your children may be going through so much of stress during this situation. They may or may not be vocal about it. Yourself as a family member or the breadwinner of the family, you'll be going through a lot. Please talk about it. And your parents, the elderly individuals in the community. We have myths and false beliefs and conceptions about the elderly parents, what they have to face and what they shouldn't be facing during this difficult time. But keep yourself informed, but on an evidence-based. So when it comes to evidence-based, collecting evidence-based information, please be vigilant. Don't believe and react to each and every social media or web page information. These days, anybody can write anything on the internet. So be vigilant. There are validated websites by the Government of Canada, World Health Organization. When it comes to mental health, Center for Addiction and Mental Health is a great resource in terms of providing up-to-date evidence-based treatment and evidence information. So please browse those resources rather than randomly browsing your Facebook, Viber, WhatsApp, so on, the other social medias.
Over the past 50 years, we've more than doubled the number of people on the planet. This means more human beings can get infected and in turn infect others, especially in densely populated cities. We also have more livestock now than we ever did over the last 10,000 years of domestication up to 1960 combined, and viruses can leap from those animals to us. As COVID-19 is painfully demonstrating our interconnected global economy, both help spread new infectious disease and, with the long supply chains, is uniquely vulnerable to the disruption that they can cause. The ability to get to nearly any spot in the world in 20 hours or fewer, and to pack a virus along with our carry-on luggage allows new diseases to emerge and to grow when they might have died out in the past. For all the advances we have made against infectious diseases, our very growth has made us more vulnerable, not less, to microbes that evolve 40 million times faster than humans do.
The third component of this is once the health issue is over and once we were able to bring Canadians to the other side of this epidemic, how do we make sure the economy builds? And that's what the governments are working on. All three levels of government collectively are working to ensure that we are able to support Canadians to get to the next stage and to make sure that our economy is going to rebuild. And there's many ideas that are floating. The City of Toronto, for example, have set out a task force. I know provincially there's a similar effort, and federally we're coordinating with all the provinces and to make sure that we are able to rebuild our economy in a way that really picks up from where we left off. These are challenging times for Canadians, and the Prime Minister has been fully engaged, and so have the other levels of government. We continuously engage them, talk to them, and we make sure that we are doing everything we can to fight the pandemic, but also to support Canadians as they individually fight. We cannot let go right now. We need to make sure that we put all of our energies into fighting this, which means staying home, socially distancing, avoiding big crowds, avoiding, going back to life as normal, because we, in order for us to win, we need all Canadians to take part.
As COVID-19 reminds us, is that infectious diseases have not vanished. In fact, there are more new ones now than ever. The number of new infectious diseases like SARS, HIV, and COVID-19 has increased by nearly fourfold over the past century. Since 1980 alone, the number of outbreaks per year has more than tripled.
Right now, I'm solely focused on trying to serve the city of Brampton well, helping our people, and we're doing some pretty innovative things in Brampton. We set up a backyard garden program where we've been delivering free gardens for people to plant for seniors and low-income families. We've got almost 6,000 signed up already. We have a program where we have volunteers do grocery shopping and pick up medications for seniors. So we're throwing our heart into taking care of people in Brampton. But I've always believed that transparency and honesty is the best recipe, and we still have some tough days ahead. I'm really worried about the long-term care centers. I think that's a crisis that is before us in Ontario and in Canada, and so we're going to have some more tough days ahead. We're certainly not. This isn't over by a long shot.
COVID-19 is very much a disease of the moment, emerging in a crowded city in a newly prosperous and connected China before spreading to the rest of the world in a matter of months. But our response to it has been both hypermodern and practically medieval. Scientists around the world are using cutting-edge tools to rapidly sequence the genome of the coronavirus, pass along information about their vigilance, and collaborate on the possible countermeasures and vaccines, all far quicker than they could have done before. But when the virus arrived among us, our only effective response was to shut down society and turn off the assembly line of global capitalism. Minus the text alerts, the video conferencing, and the Netflix, what we were doing wasn't that different from what our ancestors might have tried to halt an outbreak of the plague. The result has been chemotherapy of the global economy.
This coronavirus spreads so quickly, and if Canada had shut down the borders quicker, if China had alerted the world to the problem earlier on, there's so many what ifs. Unfortunately, it's here, and the problem is that if it doesn't choose its victims, then it affects its victims differently. Someone may have coronavirus and be mild symptoms for 14 days. Another person, it can kill them. And that's what's so challenging, is that this virus is so new that the medical community doesn't have a full understanding of how it affects people. And it's why we need everyone working together, all cylinders, whether it is the antibody test, whether it is looking for a vaccine. This virus destabilizes the global economy. It destabilizes our way of life, and we have to find a way to beat it. Well, certainly we started off slow in Ontario. Ontario had the least testing in the country. I spoke to the Premier about this, and I know he's ramped up the testing more recently. The testing this week seems to be much better, but I think that's fair to say. Just like the federal government was slow to close the borders and slow to recognize how scary this threat is, I think in Ontario they were slow to ramp up the testing, and it meant that there's many people out there who were COVID positive.
Just as the eventual emergence of something like COVID-19 was easily predictable, so too are the actions we should have taken to shore ourselves against it coming. We need to strengthen the antenna of global health to ensure that when the next virus emerges, which it will catch it faster, perhaps even sniff it out.
I like the 75% wage subsidy. The $40,000 loan is helpful because this is an economic firestorm. But I'd also say, Dr. Tam has had some mixed messages when it comes to using masks. I think some mixed messages on when this threat really started. I would have hoped that the Canadian government would have recognized the seriousness of this earlier on. Having said that, I can tell you the Deputy Prime Minister, Chrystia Freeland, reaches out regularly to Canada's big city mayors. The Minister of Infrastructure, Catherine McKenna, does as well. And so I'm grateful that they seem to be hands-on and promising and pledging to work together. Partisan affiliations have really fallen to the wayside. We got all three levels of government working closely together. I would say I think Canada was slow to recognize how serious the threat was. If we had moved quicker, then we might have been able to avoid some of the damage. And ultimately, she's responsible for giving advice to the Canadian Prime Minister on public health. I get that some of this can be an evolving science. The example of masks, I get that's an evolving science, but I think it's fair to say there's been a few examples where we have been disappointed.
To skate the margins of sustainability is itself a privilege. For a country that professes its commitment to equality, social justice, and inclusion, this pandemic may be our greatest test. Who thrives and who survives when this is all over? And whose voices do we risk losing along the way? Throughout history, nothing has killed more human beings than infectious diseases. COVID-19 shows how vulnerable we remain and how we can avoid similar pandemics in the future. We need to do all we can to not just survive this pandemic, but to ensure it remains a throwback from the past, not a sign of things to come.